any additional cost, though we are allocating some budget to it also, to the diabetes mellitus. But by and large, if we raise the community awareness, especially by utilizing the already workforce that we are having, the lady health workers, the community polio volunteers, and they can be utilized for spreading messages so that there are modifications enacted in the daily lifestyle of the people at the community level. And that's the most cost-effective intervention because it doesn't incur a single penny. It's just an awareness, and we then think at the policy level of a comprehensive behavior change communication strategy. Most of the material that we see, it's an awareness-raising material. It does not appeal as much as a more robust mechanism that is implemented so that the behavior of the people and the practices in the society are changes positively. And for that we need a behavior change communication strategy that is palatable, digestible to the communities, especially to the most marginalized communities, the far-flung areas, and where the risk is very high. That entails some responsibilities on the part of academia, politicians, professionals, private sector, media, religious scholars, and each segment of the society. I just heard about this approach towards diabetes mellitus, and I'll add to it. I think we need a whole of a society approach to prevent the scale of the problem, and also then for the treatment and rehabilitation of those who are infected with it. So the whole segment of the society, each tier, each segment, nobody is free from the responsibility to enact changes into his, her lifestyle, the community, the family, and also contributing towards the global, the national cause, which is to reduce the burden of disease and to reduce the complications associated with the diabetes mellitus. We are unnecessarily suffering from the disease burden. This is a situation that needs our thinking, why in the first instance it happened. We are aware of the demand side issue, but we are also aware of the supply side issue. Rapid testing, HbA1c, provision of medicines, provision of insulin, and health education in each and every interaction of the communities with the health facility. That would be the best way forward if we want to bring a mega change in the system and also impact and reverse the trend of the rising diabetes mellitus in the country. Sir, we, despite our meager resources, have allocated 6.7 billion Pakistani rupees into this effort in the entire country, and will be pursuing it with the provinces so that it can be augmented, and they also pool resources into this effort so the prevention at least is enacted in the country, and then the management of diabetes mellitus also, especially for those who cannot afford the medicines for it and who doesn't know where to get access, where to get services, and where to get the rehabilitative services required for patients with the complications of diabetes mellitus. So it's a primary, secondary, tertiary combination that we would like to be enacted into this effort so that nobody is left behind. Every person and individual of our society attains optimum level of awareness and education, and also the services required for prevention and management of diabetes mellitus.
निगरानी वफाकी वज़ीर बराए सेहत डॉक्टर नदीम जान